Hello, and thank you for joining us for our first episode in a three-part series of the Compass H Quick Just Culture podcast series. Today's topic is reporting near misses. I'm your moderator, Erin McGuire, a quality improvement advisor from the Kansas Healthcare Collaborative. I'm joined by Amanda Donnellan, clinical improvement consultant from the Iowa Healthcare Collaborative, and Julia Pyle, quality improvement advisor from the Kansas Healthcare Collaborative. Let's go ahead and get started with just a little bit about your background. Amanda, why don't you go ahead and jump in and tell us a little bit about yourself?
Thanks, Erin. Yes, I have worked in healthcare for over 20 years. Most of my time was spent in a critical access hospital. As many do in a critical access hospital, I've worked in a variety of roles. I started my career as an aide in high school and eventually worked my way up to the quality services manager. And then I joined Iowa Healthcare Collaborative as a clinical improvement consultant almost 3 years ago. During my time as a bedside nurse, I was involved with the patient safety committee, the adverse events team, and as a quality services manager, I helped get our Just Culture project off the ground.
Great. How about you, Julia?
Yes, good morning. I too have been in healthcare over 30 years as a registered nurse, and I spent about half of my career in critical care nursing in a large tertiary hospital before moving back to my hometown, where I then really have spent the last part of my career in critical access hospitals in leadership roles. And I joined the Kansas Healthcare Collaborative about 2.5 years ago. Like Amanda, when I was at the bedside, I was involved in a quality practice council for our ICUs. And I also was involved in several pilot programs and including a STEMI program, of which I then became a STEMI coordinator for a couple of years. So I really feel like, I'm now in a role that marries up my passions of role and quality, high quality care.
Absolutely. And I think the same is true for Amanda. And I just have to add that here in Kansas, I love working with Julia. And then at the network level, I get to spend quite a bit of time with Amanda too. And so it's awesome that you two are part of the podcast and willing to do this, and everybody can learn a lot from you. So thank you for being here. Our second question this morning is, why is reporting near misses so important to creating a culture of safety? Julia, why don't you go ahead and start?
Yeah. So, I think it's really hard to fix a problem that when we don't fully understand what's causing the issue. And a good near miss program is an important piece in creating a culture of safety because it helps us create those processes around preventing harm through identifying those root causes and or those processes and communication breakdowns that lead to harm versus just reacting to a mistake with a quick solution that might not prevent that same harm from happening again.
I think you're right. Oh, I think you're
Yeah,
right,
no, go ahead.
Julia. It is important when we think about system improvement that staff are reporting those near misses so that we can assist them with improvements. A lot of times, as healthcare workers, we do workarounds. We fix the problem at the moment
Yes.
and we forget to let others know that this is an issue and we know to fix it, but maybe somebody else doesn't. And if we don't share that, we could end up with an occurrence that harms a patient.
Yeah. Yeah, I think that's a
Absolutely.
good point.
So then why do you think that, or what, I guess I should say, what elements need to be present to create a successful near miss program?
You
Um,
know, Go ahead, Amanda.
I think we need to provide, education to the staff. Um, First of all, on what near misses are, what the reporting process is, and then what happens when they report those issues. And most importantly, staff need follow up that their near miss has been looked into. There's been process improvement, and or we need to involve them in that process improvement. The people closest to the work a lot of times have the best ideas, and we really need to make sure that there is a no blame culture in practice.
Yeah, I agree, Amanda. And I would also add user friendly. You know, sometimes we have systems in place that are difficult for our staff to utilize, and that really creates a barrier to reporting. So, having a user friendly system that anybody can report into. Maybe, it's intuitive, it's available 24 hours a day, for instance, and even making it accessible now with the technology that we have on mobile devices, for frontline staff, just that ease of being able to report is really important as well.
Julia, that's a great idea. I actually had one of my hospitals here in Iowa. They had QR codes made.
Yeah.
They were
Oh,
hanging
wow.
everywhere, and folks could scan those QR codes with their mobile devices and
Yes.
instantly were taken to that near miss reporting page. It was a homegrown page, but they could report it, and that was it. It was done. And they really saw an increase in their reporting numbers with that process.
Yes. Yep. And
That's
Amanda,
awesome.
oops, sorry, Aaron. Go
No,
ahead.
that's okay. I was just thinking of going back to, my time in the hospital. I know as working in a hospital in a non-clinical role, sometimes reporting those near misses, being encouraged to do so wasn't top of mind, so to speak. So
Uh-huh.
you were left with, how do I do that? So that QR code would be really key. A great idea, I guess, for those who may not be, I guess, so in tune to the importance of reporting, or how to report.
Yeah. Yep. I love that idea. And back to Amanda, that piece around taking corrective action. Again, that's so important. It really motivates staff when they see that they're being heard. And I don't know if you mentioned this piece, but making sure that we as leaders communicate what actions we took back to that frontline staff is really key.
So I don't know if you guys could kind of go back in time just a little bit and think about when you were working bedside, and just maybe talk a little bit about what kept you maybe from reporting. What do you think would keep employees, keep people away from reporting?
Sure. So I think early in my career as a new nurse is that fear, right? You want to be doing a good job. You don't want anybody to know you've made a mistake or possibly could have made a mistake. You want your peers to trust you, and so really making sure, I think, at new hire, and I started my career before there was the big push of just culture. Um, and so I think making sure staff know, there is a no blame, and we want to learn and we want to help you learn. And also, again, the process of reporting, I think, is important because you're taught in orientation probably how to do that, and maybe there's a space of time before you need to report something. And so I think making sure it's easy to report, like Julia had mentioned, um and then that feedback that gets back to everybody to encourage that reporting. But yeah, I can remember a couple instances where I was very first a nurse, and just worried that if I said I almost messed up something, that I was going to be in trouble.
Yeah, I agree, Amanda. Early on, there is that fear that your peers are going to judge you, or that, they're going to think you're not a good nurse. And then that's always followed by, would I get fired? Kind of thing. And so, I think those are definitely were some of the barriers I had. But in addition, one of the facilities I worked in, it was just a tough system. It was long, it was hard to navigate, and it required, a good 30 minutes if you were going to sit down and try to put in an incident report or a safety report. And so, that became a barrier that had to be addressed, because our reporting was going down. And so thankfully we had, a strong shared decision-making culture where after, hearing from nurses and clinical staff how difficult it was to use the system, they did take action and replace that. But that was a big barrier for me as well.
Thank you for sharing that. Now kind of moving just a little bit forward in time and thinking about your roles as leaders. Um, what are some lessons learned when you're thinking about trying to implement reporting, or not necessarily implement, but increase reporting of the near misses and creating that culture of safety?
I think, that the elements of just culture, we're not here to talk about just culture specifically for this podcast, but creating that culture of psychological safety where staff feel, that they're going to be heard. There's not going to be punitive action taken against them. That they're going to be part of finding solutions, as Amanda touched on earlier. That they're included in the process, and so I think those are the things that really help create that culture of reporting. That psychological safety piece is probably one of the most important from my point of view. Amanda, what do you think?
I would agree, Julia. I think too, you can't just educate to psychological safety, right? You
Yeah,
have to
yeah,
practice it. You could stand in front of mandatory meetings for days and
yes,
explain it. But unless your leaders truly believe it and practice it every day in every way, not
yeah,
just around near misses, you're still going to have folks who can see through that and say, I still don't feel safe reporting. And changing culture, I always think back to changing culture in ways around other practices, but it's not like turning around a jet ski. It's
no,
for me up here on the Mississippi, it's like turning around a barge. It
that's right.
takes a lot of time and it's slow and it takes a lot of work, but it can be done if everybody believes in it.
Yeah. And that, it goes back to good communication. When your staff, or, just all of our employees, have that clear communication from leaders. And I think, visibility, from leaders where they're out rounding and there's, relationships that are being formed. It's not near as scary, if you will, to engage in the process.
You're right, Julia. And I think even during that rounding process, leaders can ask about what's happened in your day, what workarounds have
Yes.
you had to do. Sometimes reminding staff that they've probably done something today really can help that culture and help that near miss reporting.
Yes.
That's awesome. And I think you really, um, the takeaway for me here is that just the practice, you have to practice. You have to practice the culture within your facility. It's not just saying you're doing it, you have to practice it. As we wrap up our time together today, I would just like to give you the opportunity, both you, Julia and Amanda, to share one last thought as we leave, a key takeaway for our audience.
Sure. I think one of the most important things I feel as being a bedside nurse and a leader is that it truly needs to be ingrained in your leadership, how to have a no blame culture, how to talk to your staff, how to encourage that. And that it starts even at the top. How does your C-suite encourage your leaders to have a no blame and reporting type of culture.
Yeah, I agree, Amanda, and I would just add, as a clinical um, person or a staff person at the bedside, people come to work wanting to do a good job. Nobody wants to cause harm to a patient. Um, they want to provide good care, and so it that leadership component is just so important in ensuring we're creating systems that allow our staff to do that. That we're not putting systems and processes in place that lead them to failure. So that accountability and that leadership, that it, like Amanda said, it starts there is really important, and we have to have our leaders engaged in that, um, culture piece of creating not only the culture for reporting, but ensuring that the systems and the processes that we put into place for our employees help them and lead them to doing the right thing.
Absolutely. Well, thank you both for your knowledge. I know it was well explained, and happy to have you as part of our podcast, and we look forward to episode 2.
All right. Thank you, Erin.
You.